Question 1. Enzyme deficiency in essential fructosuria. A 3-year-old child is found to have fructose in the urine, but is otherwise healthy and asymptomatic. Which of the following enzyme deficiencies is most likely responsible? A. Aldolase B, B. Fructokinase, C. Galactokinase, D. Glucose 6-phosphatase. Correct answer, B. Explanation. Essential fructosuria. Deficiency of fructokinase. Fructose is not phosphorylated or trapped in cells. Fructose spills into urine and blood, but the condition is benign and asymptomatic. A equals causes hereditary fructose intolerance, HFI, not asymptomatic. C equals involved in galactose metabolism. D converts glucose to glucose 6-phosphate. E equals involved in gluconeogenesis, von Gierke. Question 2. Enzyme deficiency in hereditary fructose intolerance. A 6-month-old infant is started on fruit and experiences vomiting, jaundice, and hypoglycemia. Labs reveal elevated liver enzymes. What is the most likely enzyme deficiency? A. Galactose 1-phosphate uridyltransferase, B. Pyruvate kinase, C. Aldolase B, D. Glucose 6-phosphate dehydrogenase, E. Fructokinase. Correct answer, C. Aldolase B. Explanation. Hereditary fructose intolerance, HFI, deficiency of aldolase B. Fructose 1-phosphate accumulates, sequesters phosphate, ATP, gluconeogenesis, and glycogenolysis. Leads to hypoglycemia, vomiting, jaundice, hepatomegaly, and liver failure. A equals classic galactosemia. B equals causes hemolytic anemia. D equals involved in NADPH production. E equals causes essential fructosuria, asymptomatic. Question 3. Pathophysiology of hereditary fructose intolerance. In hereditary fructose intolerance, which of the following metabolic consequences leads to hypoglycemia after ingestion of fruit? A. Inhibition of galactose 1-phosphate uridyltransferase. B. Accumulation of glucose 6-phosphate. C. Depletion of ATP due to trapping of phosphate in fructose 1-phosphate. D. Increased glycolysis in RBCs. E. Inhibition of aldose reductase. Correct answer, C. Depletion of ATP due to trapping of phosphate in fructose 1-phosphate ting. Explanation. Aldolase B deficiency, fructose 1-phosphate accumulates, sequesters phosphate, leads to ATP, inhibits both gluconeogenesis and glycogenolysis, leads to severe hypoglycemia. A equals related to galactosemia. B equals not the mechanism here. D equals RBCs unaffected. E equals unrelated enzyme converts glucose to sorbitol. Question 4. Diagnostic approach with urine tests. A healthy adult is found to have a positive test for reducing sugars in the urine, but a negative glucose dipstick test. What is the most likely? A. Fructokinase deficiency. B. Diabetes mellitus. C. Renal glucosuria. D. Galactosemia. E. Aldolase B deficiency. Correct answer, A. Fructokinase deficiency. Explanation. In essential fructosuria, fructose appears in urine, dipstick is glucose-specific, so test is negative, but a nonspecific reducing sugar test, like Benedict's, is positive. B equals would cause glucose-positive dipstick. C would also cause dipstick to be positive. D also shows reducing sugar, but usually with symptoms. E causes symptomatic hypoglycemia and liver dysfunction. Question 5. Treatment for hereditary fructose intolerance. What is the most appropriate long-term treatment for a patient diagnosed with hereditary fructose intolerance? A. Eliminate all dietary glucose and galactose. B. Administer fructose supplementation. C. Supplement vitamin B1 and B3. D. Avoid dietary intake of fructose, sucrose, and sorbitol. E. High protein, low fat diet. Correct answer, D. Avoid dietary intake of fructose, sucrose, and sorbitol. Explanation. Fructose, sucrose, glucose fructose, and sorbitol, converted to fructose, must be avoided in HFI, prevent symptoms and liver damage. A equals glucose is necessary and not restricted. B would worsen symptoms. C may help in other metabolic disorders but not curative. E not specific to HFI. Would you like a visual chart comparing fructose disorders, a PowerPoint summary,